While we all try to manage the day-to-day stressors of life during a pandemic, we sometimes forget that our frontliners struggle with them too. Director of Guam Behavioral Health, Teresa Areola, says there's a dedicated team that is dispatched to provide services for several GovGuam agencies.
It's the stress and the anxiety, not just of the general population of the island, but also of the healthcare providers, the frontliners, the people who are at work, who are directly or indirectly affected by COVID. So we have services for staff and workforce, and we have services for the general population. One of the things that COVID has really pushed us to do more of, that we normally don't do a lot of, is what we call the trauma response team.
The trauma response team, usually reserved for extreme incidents, has been called to action on multiple occasions during this pandemic for both COVID and non-COVID related cases.
This week alone, we mobilized the trauma response team to Guam. I see my friend Paul Tapao to do a debriefing session on the major incident that occurred this week with the Guam Police Department and the shooting. And so we responded to Guam Police Department's request to do debriefings for the officers involved in that shooting.
As we recently reported, the Port Authority of Guam suffered the loss of one of their own. Areola says she's standing by.
You had my good friend Rory Respicio on your show a couple of days ago, sometime this week, talking about the Port Authority's first death in their coworkers, among their coworkers. And he reached out to me, and we are ready to, again, dispatch a trauma response team to provide a session for those coworkers who are greatly affected by the death of their coworker.
Areola says they're here to help if any agency needs it.
So Guam Behavioral Health is here to help departments such as Guam Police Department, Port Authority of Guam. We've gone to Department of Agriculture. We've done numerous National Guard debriefing sessions that has been asked, and so many more. With GMH and Public Health, we have created connections so that we're available for their staff and have a direct line to our professional staff. So we're creating systems so that everyone in every entry point can have access to services.
And even though it was a rarity to dispatch the team, she's happy she has the people for the job.
Trauma response service is definitely a service that we never needed to do as often as we do today. But glad that we have the training and the staff that could.
Reporting for Guam's News Network, I'm Peter Santos.